health activist Dr Kgosi Letlape joins us now as we make sense of Deputy President Paul Mashatile's health scare yesterday. Doctor, great having you with us as always. Good afternoon. So the DP has been on camera, of course, talking about his ill health at a public engagement, and he himself said he was suspecting food poisoning, according to the video that is currently making rounds on yesterday's social media. And on yesterday's incident, we are then told that the collapse was due to dehydration. But what do you make of these two extremes, Doctor? Is there any medical correlation?
Good afternoon to you and good afternoon to the viewers. There would be a correlation between dehydration and food poisoning. Remember that one of the key manifestations of food poisoning would be vomiting and possibly diarrhea, which leads to fluid loss, and you can be dehydrated. We also know that we're getting into the summer, we're in springtime, and we have high temperatures. But what should also not be underestimated is the hectic schedule that some of our politicians are under, and the fact that we should take care of ourselves.
And Doctor, just on that, I mean, in essence, we understand that the workload is pretty demanding, as I'm sure you are aware. I mean, there was vigorous campaigning for elections long before the date was actually announced, leading to the May polls. So in terms of fatigue as well as other health ailments that can creep up, is there no health or wellness programs that are afforded to members, especially at such high level like the Deputy President, who has back-to-back engagements across the country and even outside of the country?
I think at that level, they would have physicians that are with them. They also have personal assistants. But you got to take care of yourself. It's personal responsibility. You are the one that understands your body better, and you need to listen to your body. And none of us are robots. So you need to take care of yourself so that you can give more to society, to your family, and to the nation. But the first thing, it's the airline principle. You know, when you get into an airline, they tell you in case of emergency, put a mask on yourself first. And I think all of us, including ordinary citizens, all of us, have to make sure that we take care of self. We need to have healthy eating habits, exercise, and take care of ourselves. Ensure that we do not overexert ourselves and we come first in our own lives.
And speaking of giving more, Doctor, I mean, are we demanding then too much from our public representatives, you think, in this regard? Or maybe proper planning from the different offices, as you said, they have personal assistants, actually needs to take extra care when scheduling engagements and appointments, especially for those who are also of a certain age, also making an observation in the case of the late former Minister Gordhan, who had recently just retired but seemingly had been ill for quite some time.
Yeah, I think the responsibility for health is personal. And we need to say no to schedules that are harmful to our own health. Because if you don't say no, you won't be doing many of those programs for too long. If you take care of yourself, you will be doing the programs for much longer. But remember also that for politicians that have a hard schedule, some of this includes long drives, and the hours are not what they should be. And you have to understand that when you are not at the top, when an order gets given, you've got to respond. And we just need to be mindful that those at the top understand that they're dealing with fellow human beings, and they are human beings themselves. And we have to have programs that are reasonable, with lots of support and lots of rest periods for those that undergo these political marathons.
And in closing, Doctor, in general, what tips can you give to those that might be suffering, of course, from dehydration, fatigue, or even suspected food poisoning?
I think you got to be alert and listen to your body. Your body will tell you when things are not well. And don't take early symptoms for granted. You have a growling stomach, you have a slight headache, you have lightheadedness, you need to take care. You need to listen to your body, and you need to take precautions. We must also be mindful just of our own eating habits, that we eat at the right time, we allow for digestion, we allow for rest. Most of these issues are about rest, and rest, so that when you engage, you are at your best. You only have one life. Take care of it. And that life is in your own hands. You can't leave it to others.
And what would we recommend, Doctor, in terms of the type of diet, particularly for those individuals that have hectic schedules? I hear you saying there that you need to allow yourself time to eat in an adequate time so that you can rest and actually digest the food.
I'm an advocate for everything in moderation. It's not about cut this out, cut this in. You know, if you get in tune with your body, you will learn that the body doesn't lie. When your clothes don't fit you, you know that you are gaining weight. And when you're gaining weight, it means you are not burning what you are putting in. And you need to either decrease intake or increase your exercise activity. It's fairly simple. And you can judge that. This notion of no red meat, extreme diets, it doesn't work. Everything in moderation, balanced diet, listen to your body. And when the belt doesn't fit, it means you are eating more than you are burning. And because of that, your body stores it as fat. Make the necessary adjustments.
And a very quick one in closing, Doctor, then how often should people, individuals, let's say over the age of 25, be going for regular checkups just to ensure and make sure that everything is still in check and balance?
You know, when you're in a corporate world, they'll advise you on annual checkups. When you're still young, you think you're fit. But every one of us should have a family physician, have a family doctor, have your own GP, and your GP will advise you on what schedule to keep in terms of checkups, depending on your own fitness and your own health. Also be mindful of your own family history and take care of yourself. You know, moderate intake of sugar, be careful of salt intake. I mean, the commonest disease that we have is hypertension, and that is salt-related, lack of exercise, sedentary life, and all those issues. You are in control of all those issues. So basically, just keep things simple. We're not talking about exercise. We're talking about physical activity. Go for a walk. Have a schedule where you know, all of us, we have smartwatches. You know, keep a smartwatch that tells you what your physical activity is. And it's not about gym membership or just having a plan for physical activity. Your garden, a walk in your neighborhood, simple things that don't cost any money.
Absolutely.
So invest in a pair of walking shoes and walk as much as you can.
Absolutely, Doc. I mean, even phones these days can actually give you tips on how you can actually maintain some of those exercise regimes. Doctor, thank you so much for your input this afternoon. Doctor, they're saying if your belt does not fit, you are eating too much, you need to start doing something about it. That is Dr Kgosi Letlape, the health activist on the collapse of Deputy President Paul Mashatile during a public event yesterday.